Democratic Congressman from Texas's 20th District, Joaquin Castro. Congressman, it is always a pleasure to have you on the show. I got to talk to you about Texas. I don't understand. I mean, Rick Perry is an ideologue, but when you look at the human toll of the decision he's making, 1.4 million uninsured people in Texas alone. You're talking about Medicaid that is being denied to parents with children making $3,737 a year. They don't qualify for Medicaid. In your opinion, as someone who knows the Lone Star State, what's it going to take to convince governors like Rick Perry to opt into this? Is it antagonism or is it persuasion? What is it?
Well, you know, we've tried the whole range of it. The fact is that his decision to reject the Medicaid money was unconscionable. 1 out of every 4 Texans doesn't have health care insurance. About 30% of Texas women, 38% of Hispanics in Texas don't have health care coverage. The business community was pretty solidly in favor of Medicaid expansion. Of course, the social advocates for the poor were in favor of it. So I think, quite frankly, Alex, what it's going to take is a change of the politics in Texas, a change of the governor for sure, but also a change of the party leadership in Texas to really make a difference.
What's amazing to me, and I think this gets often ignored, is it's not as if there's an economic argument made around not expanding Medicaid and talking about the burden on the states and so forth. But at the end of the day, emergency rooms still offer care to poor people who don't have insurance. And I'll cite this stat. The county hospital in your hometown, in San Antonio's Bexar County, currently runs a program called CareLink, which offers the poor substantially reduced fees on individual health care services rather than an insurance plan to cover them. That program serves about 60,000 people at an annual cost of $54 million. County tax dollars pay for that. Given that, I mean, this is a plain economic argument. It will cost taxpayers less to insure these people. I mean, is there any reasonable argument you can make at this point?
No, you know, I think there's an old adage in politics that Democrats or liberals make their decisions from their heart and Republicans or conservatives make them from their mind. Well, here, in both the heart and the mind, it's clear what should be done. Medicaid should be expanded, and still, the governor is not yielding to reason.
Congressman, I'm going to open this up to our folks in New York. David, we were talking about the human cost of this.
Yes.
And that's one of the reasons we felt strongly that we needed to read that excerpt from the New York Times, that people who have cancer cannot go get the treatment required and are forced into either poverty or they die because they are not given adequate health insurance and health care. Do you think that the anecdotes and the anecdotal evidence is going to be enough to ultimately sway some of these people who are resisting?
Well, I don't know about Governor Perry. I heard him on television recently say people in my state have access to the greatest health care in the world. And in fact, they do have some of the greatest health care in the world down there, but it's just the people we're talking about don't have access to it. I remember when my child was sick and I was sitting in the emergency room and I saw others who were in more strapped circumstances than me sitting there in utter panic thinking about how in the world they were going to afford the health care they needed to keep their kids going. You're right, some of it is transferred to taxpayers, but they don't have access to a lot of the health care that they need. And, you know, we have to ask ourselves, is this the America we believe in? A lot of the people we're talking about, most of them are working people, you know, and so you work, and then you don't have basic health care. And is that the country that we believe in? Governor Perry says this is rugged individualism. I think it's heartlessness.
You know, Joy, what is disturbing to me about the argument in and around the ACA is that it's increasingly become one that the Republicans are framing in terms of takers versus makers. Right. The people that are just trying to, you know, get the old sick people that are trying to take from us young, invincible, you know, money-making business people or whoever the makers are in that metaphor. And when in reality, the ACA is much more in common with something like Social Security. And at the point Ron Brownstein makes, I wonder if that narrative is too far cemented in conservative circles at this point.
Yeah, and I think it is. And I think that's why they've, and partly been so successful at framing the debate as being all about the individual market buyers, because those people are by definition slightly more affluent, you must say, than people who are getting through Medicaid, and why we've completely ignored, I mean, that huge number of people that you mentioned that are actually getting it in card through the Medicaid expansion, because literally it is seen as a failure in the system, not a feature of it, that people are getting care through Medicaid because it's seen as just more welfare. That's the way it's talked about. And I mean, to your point of what's the pivot point that will change this narrative, one of them might be big hospital systems that are starting to look at bankruptcy. Yeah. I know in the state of Florida, the governor of Florida, no liberal, and a guy whose previous claim to fame was that his hospital system defrauded the federal government for $1.8 billion. He actually was going to go ahead and take the Medicaid expansion, not because he liked it ideology, he's a Tea Partier, but because hospital systems are still treating people who have no insurance card and are facing bankruptcy as a result. And even the pressure of the business community couldn't convince the legislature, which slapped Rick Scott down and said, no, we're not taking this money. We're creating two Americas, one in the former Confederacy and in the Midwest, where literally if you aren't rich, you cannot get treated unless you go to the ER. And then another in which we have a wholesome healthcare system. It doesn't make any sense.
But here's one of the concerns. There are all of these effects that you're talking about, and I think that the Republicans are intent on blaming the Affordable Care Act for it. And this is really, I mean, the big story is never before has there been something undertaken like this under this kind of sniper fire. Yeah. And that has made this so much more difficult. And so I'm concerned that they're going to take what is the effect of their obstinance and their opposition and blame it on the Affordable Care Act when it's their opposition that's actually depriving people of the care they need, putting pressure on these hospitals, putting more pressure on taxpayers. I think it's a real concern.
But, you know, Congressman, the hospitals and their insurers know the truth. I mean, they know exactly why things are as bad as they are. And I wonder, in Texas, how much sway does that business community have in terms of decision-making in and around the state's health care?
Believe me, the Texas Hospital Association and others in the medical industry, and they push pretty hard in ways that I had not seen them push Republicans in the 10 years that I spent in the legislature. But Texas is almost a special case because Republican incumbents, including Governor Perry, feel like they have so much wiggle room in the November elections that they can ignore even some of their traditional allies. And I think that's what you saw in his refusal to expand Medicaid. And just to Joy and David's point, you know, the language that these folks are using is very disturbing. Ted Cruz, in the press conference he had with Rick Perry when they talked about Medicaid expansion, compared people who need Medicaid to drug users and compared giving these folks Medicaid to giving them a hit of drugs. That is extremely disturbing for a United States Senator to be talking in those terms.
I think basically everything Ted Cruz does and says is extremely disturbing, but I think that was very fair of you. Texas Congressman Joaquin Castro, we look forward to a change of governors sooner rather than later. Thanks for your time.